right, we're going to be taking a look at how to do the intraoral exam. First thing, when we lay the patient back after we've done the extraoral exam and the pre-procedural rinse, we're going to take a look at the outside. We're going to look at her lips, her vermilion zone, vermilion border, the labial commissures to see if there's any cracks or fissures or sores around the lip area. Then we're going to take a look inside. We're going to move the lips out, look at the frenums, take a look at the labial mucosa, the buccal mucosa, all the way around. Make sure there's no aphthous ulcers, anything that's going to be painful if we pull on it for the patient. I'm going to take my mirror and I'm going to look at the maxillary tuberosities and look around at the palate. I would normally have my light adjusted a little bit better, but it'll kind of compromise the, thank you, it'll compromise our position with the camera. So I'm looking on the lingual, and I'm just looking all around the buccal mucosa, labial mucosa. Now I'm going to feel around that area. I'm going to use a bidigital palpation starting at the center of the upper lip, and then kind of move and compress the tissue around where the parotid gland is here. Compress the tissue, and I'm feeling for any masses or any abnormal lumps or bumps. And I'm using the acronym RUMP, white, red, ulcerated, massive, or pigmented when I'm looking for anything unusual. I'm going to use a digital palpation and feel around where the maxillary tori would be located on the lingual surface. And I'm going to feel for any exostosis on the buccal surface. I'm going to come around here and feel on the maxillary area for exostosis. I'm going to feel on the hard palate with the digital palpation for max tori. And then I'm going to feel the floor of the mouth where the sublingual salivary gland is. I'm feeling with a finger from one hand and finger or part of the hand. And this is a bimanual palpation technique. So I'm using two hands, or a surface from two hands. And I'm compressing the tissue where that sublingual salivary gland is between my finger on one hand and my finger on the other. And then I'm going to take some gauze, wet the gauze, and make a sling so that I can move her tongue from side to side. I'm looking at the lateral border of the tongue, and I'm going to get it back in the sling there and move it this way so I can take a look all the way back, because that's a common place where oral cancer is found. Go ahead and stick it out. So I'm going to feel, and then I'm going to have her stick it up to the roof of her mouth so I can look at the ventral surface. And then I'm looking at the dorsal surface as well as the oropharynx area. I'm looking at the anterior and posterior facial pillars, the palatine tonsils, the uvula, soft palate area. I'm looking for anything white, red, ulcerated, massive, or pigmented. She does have a little redness there on that side. All right. Looking at the tongue. Then we're going to take a look over at the parotid papilla area where the Stenson's duct is. And we're going to kind of dry it off right here, and then we're going to just kind of see if saliva comes right back to it when we push on it. She's got a good salivary flow. And the same thing on this side. We're going to dry it off, and then we're going to see if the saliva comes back to it. And it does right away. All right. I'm going to have her close together, as we would next be checking occlusion, but we haven't got to that point yet. So there's your intraoral exam.